I started to get unhappy with the way the cellulite on my thighs was looking, so I decided to do something about it. Over the past couple of years, and it's really starting to bother me, so...
Is it cellulite? It's estimated that 85% of adult women have cellulite, and I think the other 15% think they have it. Cellulite itself is the thinning of the skin, the dimpling and that contour irregularity, along with the pics, which are the depressions caused by the fibrous septae, which are pulling down the skin. Finally, there's extra fat beneath the skin causing that cottage cheese look. So there's three parts that actually cause the cellulite: the extra fat, the thinning skin, and those fibrous septae. And we've used many techniques to get rid of cellulite. There's been rollers and potions and lotions and lasers and all kinds of things have been tried, but nothing until just now has been successful. Cellulaze is the first effective long-term solution for cellulite. Good morning, good to see you.
Hi, Grant.
Tell us about Cellulaze.
Well, Cellulaze is a long-term treatment for cellulite, and as you said, we've gone through rollers and suckers and pills and creams, and none of that worked. The Cellulaze device, we've worked on research for 3 years now. We've done 3 sets of studies. We've done a multi-center trial across the country for the FDA, and that has been cleared. So this is a single treatment with long-term results. Our longest patients are going on 3 years now, and in our first study we had 93% satisfaction. So when you put it all together, Cellulaze is the solution to that long-term problem. Cellulaze is very special because it is the only treatment for cellulite that really goes down to the 3 anatomic causes of cellulite under the skin.
So what sets Cellulaze apart from all the other procedures we've tried over the years?
Cellulaze is a laser, and it's connected to this little fiber which fires the laser sideways. This is called the side light. And this is what allows us to go under the skin through a little pinhole, so it's minimally invasive procedure, and the laser can then be aimed upward, sideways, and downward to treat the 3 problems of the skin architecture. It's not a non-surgical procedure. It's not something we're doing from the surface. It is going under the skin, but tiny little entry point under the skin, and then we treat everything under the skin. We couldn't achieve a long-term treatment of cellulite, knowing now what causes it, by going externally. We have to do this, so it's really considered a minimally invasive procedure. She's our first patient, so let's evaluate if she's a good candidate for the Cellulaze treatment. So Grant, you can see that we have these deep depressions in numerous areas. We have hills, valleys. This is considered the grade 3 cellulite, and in addition we have a background of more dimpling or mattress pattern. So we're going to go ahead and treat this whole area, but I think we'll flatten that out beautifully. There's some grade 3 cellulite here. We don't see it really well.
Right.
Let's bring this light in and
It
look at
jumps
that.
right off. Look at that.
Look
at that depression and bulge.
Lighting is so important in photography and in surgery. Continuing with raised areas, so this area here is raised. This area up here has a slope. Raised areas I think are addressed there. Now I'm going to take the red marker, because green means go. Go
Right.
beat it down flat. Red is the depressed area. So there's one over here. We have depressed area in here and here. There's a little one here. And then you pointed out 2 little blips. And I would just do a little bit over there.
Okay.
And let's come back. So at this point, we look to see that we have a smoothness everywhere else, or mattress pattern cellulite everywhere else, which we do. So we've gotten our raised areas, our depressed areas. Now we're going to apply the grid, and this is a grid of the 5 by 5 centimeter squares. And if you want to just hold the other end there, we're going to now, we used to do this freehand, but now we have a nice template, and we're going to go ahead and make our squares around all the borders, because all of our energy settings are based on 5 by 5 centimeter segments of energy. These are the depressed areas, so that's going to be in red. Those are the fiber septi that are pulling down, and we're going to use the side firing fiber to saw across that, and we'll see those pop up. The other areas that are raised are the excess subdermal fat here, here, and we're going to be aiming downward with the side firing fiber to flatten those out. There's no liposuction in this. The efficiency of the 1440 alone is enough to bring these down.
Right over here, we get you on the operating room table.
This is the newly designed handpiece for the Cellulaze unit, and this is quite a piece of engineering. It enters into the process a lot of new safety mechanisms. It has this green light, which is called Smart Sense, which is actually monitoring our motion back and forth like the Wii game you have. If the motion stops while the laser's firing, it shuts the laser off in 0.2 seconds. The other piece of technology in here is called the Thermoguide, which you can't see it. It's a little sensor at the tip of the laser, and it's monitoring the current temperature at the tip as we're doing the procedure. It's set at 47 degrees centigrade, and once we hit that level, which we need to achieve, it will shut the laser off from firing. The fiber itself is called a side light, and it's very tiny, it's very hard to see, but what's going on here is we have a bevel in the laser, like this, and the light, that's like a mirror, and the light is traveling, hitting that, and then coming out to the side. There's a little bit going forward as well, but most is going out to the side, and this is how we're going to be treating the components of the cellulite. I'm turning the handle, and I'm turning it in such a way that this is the laser firing down, and you can see that bright light, which is about 60% of the energy, and then you have some energy going forward as well, which helps us to move through the tissue. But this brighter one is what's doing most of the work to attack the cellulite. Dr. Stevens, what part of the procedure are you doing now?
We're preparing the patient by anesthetizing the area. We're putting this area to sleep with a local anesthetic. Our patient's awake, listening to her favorite tunes.
And then I'll place some heat all around, so now I'm just working across and watching temperature. I'm at 43 already. 45. Good. Almost there. They're going to make it to 1,000.
Melissa's procedure is finished now, and she's done great. She tolerated very well, she was comfortable the whole time, and we could feel those little irregularities disappear with the laser.
It's been 3 weeks since my Cellulaze procedure, and my cellulite has gotten a lot better. It's supposed to keep improving for several months.
Melissa is 3 weeks out now from her Cellulaze treatment, and she's looking terrific. Her thighs are smooth, and the pics are gone. Her cellulite is eliminated.